Good afternoon. Uh, Glad to see everyone on this chilly day, but an incredibly important day. Months ago, I said that we could see the end of COVID-19 on the horizon, but only if we mask up to stop the spread and get vaccinated to protect our families and our communities from serious illness. I've spoken often about losing my last living uncle to COVID-19 in a nursing home. No family should go through that kind of heartbreak. And getting vaccinated is the best way to avoid serious illness, stay out of the hospital, and keep our families and communities safe. That's why I got vaccinated right away when I could. And this morning, I got my booster. St. Louis was one of the first major cities in the Midwest to implement a vaccination order for city employees to protect all of our residents against the virus. I'm happy to report that more than 75% of city workers have gotten vaccinated, and we continue to work to get those numbers up, and as the rest face weekly testing. I also made sure that my 14-year-old son, Aiden, got vaccinated too, so he can keep enjoying in-person learning with his friends and teachers. I feel better knowing that he's protected from COVID-19, and he plays basketball. So getting vaccinated helps him so he can stay on the court, which is his favorite place to be, and continue to do the things that he loves. Vaccination is safe and effective. Vaccines save lives. Now, with approval from multiple agencies after an extensive study and review, the Pfizer vaccine has been made available for 5 to 11-year-old children. I understand firsthand how devastating it can be when kids are sent home due to COVID-19 outbreaks. And I recognize how important it is to keep our schools open, safe, and healthy. And as the holiday season approaches, we want to be able to gather safely with our families without fear of spreading the virus and serious illness. Pediatric vaccination is the key to protecting our babies, protecting our schools, and protecting our communities. As a mother, as a niece, as a sister, and an elected leader, I strongly urge every family to get their eligible children vaccinated against COVID-19. We have to vaccinate kids to keep them learning in person instead of virtually, so they can play sports, go to school events, and do the things that they love. Do it to protect our grandmas and grandpas, our abuelas and our papis, our aunties and uncles, and all of our loved ones this holiday season. Make sure your eligible family members are vaccinated to protect our schools, our city, and our loved ones against this virus. Together, we can make sure the rest of the school year is the very best it can be, and our holiday season is healthy and safe. I want to thank St. Louis Public Schools Superintendent Dr. Kelvin Adams for his leadership in holding vaccination clinics for students throughout the school year, and now hosting upcoming vaccine clinics for children aged 5 to 11. We're here in front of Gateway Elementary, which will host a vaccine clinic for children on November 13th and again on December 4th. It's this kind of community engagement that's important to making sure that their children and families are connected to vaccines. And now I want to turn it over to Dr. Hlshwayo Davis, who can walk through how the city is using its partnerships with our health systems and schools and federally qualified health centers to make sure kids and their families get protected against COVID-19. We know getting kids vaccinated will be different than past efforts. We're hoping that this community-centered approach, different than previous vaccination pushes for adults, will meet kids where they are and in comfortable environments for them. Dr. Mati?
Thank you. Good morning, everybody. So good afternoon, first of all. So the recent authorization of the Pfizer COVID vaccine for children 5 to 11 is something we've all been looking forward to, and it's finally here. I'd like to start by emphasizing that COVID-19 vaccines are our most effective tool in preventing severe complications, hospitalizations, and deaths from COVID-19 and SARS-CoV-2, the virus that causes COVID-19. Although the vaccine was developed rapidly, all steps have been taken to ensure that it is safe, that it is effective. The City of St. Louis will be implementing a community-based approach to COVID-19 vaccinations for children aged 5 to 11. This approach will ensure citywide access to the vaccine and ensure that parents and caregivers have the opportunity to take their children to healthcare providers with whom they feel comfortable. We will be networking with trusted community messengers, schools, community-based partners, healthcare providers, and members from the general public to make sure we have an equitable approach to our vaccine efforts. Our plan has 4 major components. First, the identification of vaccination partners in our community to leverage existing trust and relationships to provide COVID-19 vaccines to children aged 5 to 11. These partners will include Affinia Healthcare, Care STL Health, Betty Jean Kerr People's Health Center, BJC Healthcare, SSM Health, SLPS, charter schools, and independent schools, amongst others. Number 2, supporting vaccination clinics sponsored by our partner agencies. So this will include coordination of clinic and non-clinical support staff, vaccination supplies, document production for EUA sheets and vSafe flyers and clinic advertising, as well as vaccine education messaging. Number 3, monitoring the pediatric rollout and identifying any necessary adjustments. And finally, identifying gaps that could impact clinics led by the Department of Health. I also want to take the opportunity to remind the public that even though the vaccine is now available to those aged 5 to 11 until vaccination levels increase, we still need to continue practicing those mitigation measures we've been using, such as wearing face coverings when indoors, around persons not in our household, social distancing, and having events outdoors, all things we know can prevent the spread of the virus. Listen, folks, this is personal for me. I have a baby that turns 5 in November. I gave birth to a baby in May of last year. There's nothing scarier for a parent than not having every tool available to protect your kids. Honestly, I may weep when I take my child in November when it's her turn. This is very personal for me, very personal for all of us here. I'd like to close by saying that increasing access to healthcare for our residents is a primary focus for the Department of Health. It's one of the essential services of public health. Our community-based approach to getting these children aged 5 to 11 COVID-19 vaccination will also help ensure that they have opportunities to find healthcare homes. This can't be a one-stop shop, right? This is one area our FQHCs and hospital systems will be assisting. Finding healthcare homes for children and families who currently do not have one will provide major benefits to families behind COVID-19. Thank you so much.
Dr. Adams.
Good evening, and I want to thank the mayor and Dr. Davis both for being here as we have this conversation about what's going to happen as it relates to our students. 9,190. That's the number of students who became eligible yesterday for a vaccination in the St. Louis Public School District. Over 3,000 students have been quarantined as a result of contact tracing by being exposed to a student or a teacher who likely had the virus. This is a game changer for public education because it gives us an opportunity to keep students in the classroom. The partnership with the city, the partnership with Dr. Davis is incredibly important. As you've already heard, on the 13th of this month, in this building, we will start the process of actually putting shots in arms for every single student in the St. Louis Public School District who wants to have the shot. I think the doctor has made it really clear that this is an important, life-changing time for students. They have not had the opportunity for that to occur prior to this time. And so I'm incredibly excited that the city has always been a partner with us, and under Dr. Echols' leadership and now under Dr. Davis' leadership, have been real partners in terms of working with us as we work with the details that have to take place as we determine how best to provide education to students who are in the classroom every single day in the context of a pandemic and a virus. And so I just want to say to our partners behind me, thank you very much for making this a priority for students. I want to thank the health agencies as well, who have always partnered with us to try to make sure that we're doing everything in our power to give students an opportunity to be successful in the classroom, and that only occurs if they are if they're present every single day. The American Federation of Teachers, to my right, have been a real strong partner in making sure that all of our staff, at this point in time, 97% of our staff have been vaccinated. 97% as of October the 15th. And so teachers are leaning in every single day to try to make sure that students are being given the best opportunity to be successful. And so I just want to say thank you to the mayor and thank you to Dr. Davis for their partnership. She started last week and she contacted me as early as yesterday for this conversation to take place, making young people a priority in this effort around the vaccinations. And so November the 13th, in this particular building will be the first day, and December the 4th. Students will have to come with their parents. We will give them an opportunity to fill out a DocuSign online such that they can have the ability to do it virtually in terms of signing, and then they would have to show up here from 9 until 12 for the vaccinations to start. Again, I want to say thank you for being here, but more importantly, thank you for the support that we're getting as it relates to making sure that students get an opportunity to be vaccinated and therefore not have to quarantine and therefore not have to miss school days, and more importantly, not be in danger of being sick as a result of the pandemic and the virus. Thank you very much.
I'm Byron Clemes with the American Federation of Teachers, St. Louis. I want to thank the good doctor, the mayor, and Superintendent Adams. This is an exciting time for our employees in the St. Louis Public Schools. This is looking towards a new normal. You know, we're looking towards these layers of protection so that someday soon a sports team might be able to play, if everybody's been vaccinated, without wearing masks. We're looking forward to that. Seeing grandma safely, we're looking forward to that. So I'm proud to say that our national union has extended a grant for us to continue to do our outreach with the city health department, the community, and the St. Louis Public Schools. So we'll be phone banking, knocking on doors, trying to get the community to turn out. But this is great news. Thank you to our partners.